Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves. To help improve your assessment skills, the American Heart Association training series includes videos of actual children with medical problems. Of course, at no time was medical care delayed for the purpose of obtaining this video. All children received timely and appropriate medical care, and parents provided consent before recording. Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. On any given day and at any given time, you could encounter a victim of cardiac arrest. And with the training you received today, your actions can give the victim the best chance of survival. But first, let's talk about the pediatric chains of survival. The causes and treatment of cardiac arrest differ between in-hospital cardiac arrest, also called IHCA, and out-of-hospital cardiac arrest, also called OHCA. Therefore, specific chains of survival have been created for each of these populations. There are 6 links in each chain. The first link in the pediatric chain of survival is prevention and preparedness, including responder training, early recognition of cardiac arrest, and rapid response teams. The second and third links are activation of the emergency response system and high-quality CPR, including early defibrillation. Next comes advanced resuscitation interventions, followed by post-cardiac arrest care. The 6th link in both the OHCA and IHCA chains of survival is recovery. This chain is a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. To begin training, we'll focus on individual skills that rescuers perform. It's most effective to perform CPR as a team. However, to be an effective team member, you'll need to possess the individual skills of CPR. So, we'll start there. As a healthcare provider, your first step is to verify scene safety. Then, tap and shout to check for responsiveness.
Hey, are you okay? Are you okay?
If there is no response, you should shout for nearby help or activate the emergency response system in your workplace.
Activate the emergency response and get an AED.
Check for a carotid pulse. Locate the child's trachea by using 2 or 3 fingers, and then slide your fingers into the groove just to one side of the trachea where you can feel the carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you, the rescuer. Check for breathing by scanning the child's chest, looking for chest rise and fall. You can scan for breathing and check a pulse simultaneously to minimize time before the first compression. The check for breathing and a pulse should take at least 5 but no more than 10 seconds. If you observe no breathing or only gasping and you do not feel a pulse within 10 seconds, start CPR immediately. A bit later in this course, we'll talk about what to do if someone is unresponsive, is not breathing, but a pulse is felt. But right now, we're assuming you don't feel a pulse, so you need to do compressions. By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. After you give compressions, open the child's airway and deliver breaths. It's important to minimize interruptions in chest compressions to less than 10 seconds. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. Once you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of the return of spontaneous circulation, or ROSC. Breaths should be given with a barrier device, such as a pocket mask or face shield, during one rescuer CPR. In some circumstances, a workplace may have only a bag mask device available. In these instances, you may complete your skills test with a bag mask device. In the clinical setting, a rescuer may not be able to deliver 2 breaths within 10 seconds when using a bag mask device during one rescuer CPR. The American Heart Association and BLS guidelines define anyone from age 1 year to puberty as a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions. To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest, which equates to approximately 2 inches or 5 centimeters, and the chest must recoil completely between compressions. With single rescuer CPR, you'll always use a compression to ventilation ratio of 30 compressions to 2 breaths. However, when performing 2 rescuer CPR on a child, the ratio changes and should be 15 compressions to 2 breaths. Before we start, you need to make sure that the child is on a firm, flat surface lying face up. Quickly move bulky clothing out of the way that is covering the child or infant's chest so that you can locate appropriate hand or finger placement for compressions. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the sternum. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands, with your elbows straight. And when we start, remember to push straight down on the sternum to get adequate depth. When you push, push hard and fast.